All right, so here we are. Just finished up a little round of ice and E-stem to help Eric out. I also wanted to mention a little bit that sometimes patients can't lie like this all the way fully supine at this stage of their recovery. It can make them kind of sick feeling. Eric's tolerating it pretty well. We do have another table in our clinic that has an elevated head with some bolsters and some wedges. Sometimes I got to prop some people up and be creative with that. But for the purposes of filming and being able to see what I'm doing, I think this is a good position, and Eric's tolerating it pretty well. So, as we know with Eric's surgery, he had a slap repair, which is where the bicep kind of attaches to the socket of the shoulder. So he's not really allowed to do any kind of isolated bicep work. And he's been in a sling, and I'm not sure how much he's been doing at home as far as stretching this elbow out a little bit. But I like to try to, with the arm supported, can't really see, but the purpose of having that towel and that pillow underneath him is to really keep the arm from going back into extension. That's really when we don't really want to be loading that anterior part of that labrum, that superior aspect of the labrum where the bicep comes in by really pushing him back this way. Wouldn't feel so good. So I got his arm kind of in a neutral position, and now I can kind of stretch out this bicep a little bit. My other hand is kind of up here, just giving him a little gentle traction. And I just want to start working on the elbow a little bit. Something on those lines. How's that feel? Yeah. So if your therapist hopefully has some education or training, or the therapist is watching this video, I encourage you to get some educational and training and some manual therapy techniques, myofascial release, active release therapy, some things on those lines come in very handy for all of our patients. But it's pretty amazing how quickly people can develop some fascial restrictions, which is kind of the connective tissue between muscle and skin. It's a big web that wraps around our whole entire body under our skin. And the fascia needs to be kind of soft and rubbery and have this nice elastic component to it. It does have a cellular matrix to it, and it can get pretty bound down pretty quickly. Certainly with with trauma like surgery, you have the bleeding and the things associated with that and the swelling. So Eric, why don't you just go ahead and do some active hand exercises here. I want you to just kind of open and close your hand, wrist up and down. That kind of stuff, palm up, palm down. There we go. And then go ahead and bend your elbow. And then straighten your elbow. So I'm actually giving a little manual resistance to elbow extension. Nothing wrong with that. That's actually going to inhibit the bicep a little bit. Call that reciprocal inhibition. Go ahead and bend it. If this was painful, I might give him a little active assisted on the elbow flexion. And then go ahead and extend. And again, I'm giving him a little resistance on that tricep to turn the bicep off a little bit. So we're going to do that again. Kind of palm up towards you. And then we're going to do a little PNF, a little Tai Chi. So you just kind of get some action through that arm like that. All right, so patients are pretty much clear to do any hand, wrist, forearm exercises they want to do as long as their arm is supported. If you're sleeping in a recliner, you can come out of the sling and you can do all that stuff sitting there with your arm kind of on the armrest of the recliner. Or you can use some pillows and some props to do that. Don't try to do these with the arm not supported. It won't work real well. You'll have some pulling and sensations in the shoulder, and you'll be not feeling too good if you do that. So now we're going to move his arm around a little bit. So I'm going to show you how I kind of get in here and support his arm. I think it's to be a little tricky. But again, I'm going to come in and I'm going to kind of get in real close and tight so he feels fairly secure with me moving his arms around. Now I'm going to take this stuff away. I'll hold on to the towel. Put the towel back. All right, so we're back. And Eric's got a lot of guarding. You know, we did the ice and the E-stem to try to calm him down a little bit. Hasn't really moved the arm around too much other than some pendulum swings. And as I was trying to work on a little bit of abduction, moving his arm away from his body and a little bit of rotation, he wasn't too happy. So I'm going to show a variety of techniques to try to impart some relaxation, and these are called indirect oscillations. So oscillations we do with people, it's kind of a neurological type therapy where we try to get the muscle tone down. And what I'm going to do is I'm going to go across to his left leg and kind of in line with that shoulder over there, and I'm going to kind of oscillate him like that. And actually I'm getting some rotation up there by doing this. How does that feel, Eric? So, you know, sometimes people can't really handling their arm real well in the beginning, but I want to try to get some relaxation. So this is an indirect oscillation across the diagonal. The other thing I will do sometimes if people are really not feeling so good is I'll kind of go down here for the feet. And this is going through the whole chain now, all the way up to the head. I can see some head nodding going on, which is kind of nice. Kind of relax these suboccipital muscles, which can give people some headaches. He's wearing a sling, a lot of muscle tension going on. So that's the way we can kind of try to get some of the guarding out of there. But I do really want to try to move his shoulder a little bit today. I do feel like it needs to move, even though he's not feeling so good. So I'm going to go back over here and hopefully try to work on a little bit of some motion of this thing.